There is a shortage of help for people with urgent mental health issues here in the Treasure Valley.
Short and long-term facilities are consistently at capacity with long waiting lists for people seeking help. And the Boise Police Department says the number of people in need is growing. Gretchen Parsons tells us more about the lack of options out there.
That's right, guys. The Boise Police Department says the amount of 911 calls they get regarding someone in a mental health crisis is on the rise. There's only one facility free of charge that's able to treat these people for more than 24 hours. And with more people in need of this service, that puts more strain on the already limited resources. Emergency phone calls involving someone in a mental health crisis have risen more than 3% in the last year.
Our biggest call for service increase is around mental health. In the last 5 years.
And while that may not sound significant, it's a noticeable increase in patients inside Treasure Valley treatment centers.
We are almost always full at 16 beds, and we generally always have a waiting list. And the waiting list is typically up to about a dozen people that are trying to get in on any given day.
Heidi Hart is the CEO of Terry Riley, which oversees the Allenbaugh House. It's a place for people to get treatment who are experiencing a mental health crisis, whether that's because of drugs or other diagnoses.
We're one of the few facilities like this in the country where we bridge both mental health and substance use needs and operate as a short-term stay.
Patients can stay at the Allenbaugh House for up to a week. It's the only place free of charge where people can get this type of treatment and stay longer than 24 hours.
That also puts strain on the system to make sure that the resources are there to help people.
The Allenbaugh House only takes patients from Ada, Boise, Valley, and Elmore counties. Hart says the need is statewide.
To be able to have a resource like that in Canyon County would be fabulous because the community is growing and the needs are here.
For now, Canyon County only has one state-funded short-term crisis center where people can't stay for longer than a full day. Hart hopes funding for more resources like the Allenbaugh House will eventually catch up with the growing population.
Those are folks in the community that are trying to access services that we can't provide care for.
Both Chief Bones and Hart would like to see the legislature allocate more funding so they can create more resources like the Allenbaugh House.
And the way the legislature addressed the PTSI from this last legislative session, you would think they'd be more open to some of these mental health issues. So we'll see what happens with that as we go into the future.